Osteoarthritis or osteoarthrosis is the most common form of the arthritis. Etiology: osteoarthritis was previously thought to be normal consequence of aging, thereby leading to the term degenerative joint disease. However, it is now realized that multiple factors play a role in the causation of the osteoarthritis. There are many risk factors for the development of the osteoarthritis, which are as follows: advancing age, female sex, obesity, female, obese female, aged obese female, shipyard worker, sports injury, previous injury to joint, muscle weakness, proprioceptive deficit, genetic factors, acromegaly, calcium crystal deposition. Just remember a story to remember all the etiologies. Okay, risk factors, etiologies, whatever you can say. Just remember a story. There was this girl who was a Olympic champion, who was an athlete. She was so tall, so thin. There were no muscles developed. She was so thin. She was so much tall. So that's why they have taken. She was athlete and she competed in the Olympics. Okay, now she is older and her grandmother suffered from the osteoarthritis. Now she got older. She suddenly became obese, and this is the story. After the athletic work, when she completed her athletic career at the age of 30 or something, she used to work at the shipyard, carrying the loads and all. So when she got old, she sat in her home, she got fat, obesity developed, all these things. By this you can remember genetic factors. Risk factors are genetic factors, acromegaly, muscle weakness, previous injury to the joint. When she was athlete, she got injured, sports activity, shipyard worker, female sex, age, obesity, proprioceptive deficit, genetic factor, calcium crystal deposits. Many insults such as trauma, repetitive loading, metabolic, genetic and constitutional insults may damage a synovial joint and trigger the repair process. The repair process involves new bone formation and remodeling of the joint space, joint shape. It will remodel the joint shape. Earlier it was some other shape. Now it has become some other shape of joint. Okay. New bone formation occurs at the margin of the joints. Margin of the joints, there are osteophytes. New bones at the margin of the joint are called as osteophytes. This may result in the anatomically altered but pain-free functioning joint. It is anatomically altered joint, but it is pain-free. It does not cause any pain. There is a osteophytes at the margin of the joint. However, poor repair process may result in the progressive symptoms and joint failure. It will lead to it is painless, but as the days progress, there is progressive symptoms develop and joint failure occurs. Pathologically, there is fissuring of the articular cartilage. It is called as a fibrillation. Fibrillation means fissuring of the articular cartilage, development of the deep vertical clefts, localized chondrocyte death, and decrease in the cartilage thickness. Decrease in the cartilage thickness. There are vertical clefts, deep vertical clefts. Fibrillation develops, chondrocyte death and decrease in the cartilage thickness. Decrease in the thickness of the articular cartilage results in the decrease in the joint space. The bone immediately below the damaged articular cartilage develops cysts. Because there is a decrease in the cartilage, the bone will be opposite to the another bone, no? So that's why cysts will form in the bone. And there is increase in its trabecular thickness. The synovium also undergoes variable degrees of hyperplasia. These synovial changes may sometimes resemble those of the rheumatoid arthritis. What happens as the days pass? There are fissures in the cartilage of the joint, and thinning of the cartilage occurs. As there is thinning of the cartilage, the bone starts to form cysts, and the synovium start to undergo hyperplasia. This resembles rheumatoid arthritis. Coming to the clinical features. Clinical feature, there is main symptom of osteoarthritis is pain and restriction of joint movements. Patient usually above the 45 years, often over 60 years. Pain will be there, restriction of movement will be there. Pain is of an insidious onset over months to years. There is chronic pain. Usually one or few joints are affected, and weight bearing joints are more commonly affected, such as knee and hip. There is this restriction of movement, there is pain throughout the month, throughout the years. It is variable or intermittent over time. That is, some days are good, some days are bad, good days and bad days. It is worse on a movements and weight bearing. Whenever you carry something, you feel so much pain, and on movement you feel so much pain. Morning stiffness is less than 15 minutes compared to the rheumatoid arthritis, which occurs along hours together. Morning stiffness will be, if it is hours together, then it is rheumatoid arthritis. If short duration, that is less than 15 minutes, it is osteoarthritis. Examination of the involved joint shows the restriction of movement due to the capsular thickness. Because the capsule is thick, that's why movement is restricted. Coarse crepitus movement due to the coarse crepitus movement due to the rough articular surfaces, that why coarse crepitus on the movement. Bony swelling because of the osteophytes, joint deformity, joint line tenderness, muscle wasting is present around the involved joint. Generalized osteoarthritis involves multiple joints. It initially starts at the interphalangeal joint of the fingers, affecting the distal interphalangeal joint. Okay, first it starts at the interphalangeal joint, affecting the distal interphalangeal joint first. Then more commonly it is distal interphalangeal joint. Affected joint develop posterolateral swelling on each side of the extensor tendon, which enlarges and hardens to become Heberden in the distal Heberden nodes. It is called as a Heberden nodes. Heberden. Okay. Extensor tendon, along the extensor tendon at the DIP, distal interphalangeal joint, both side posterolaterally there are nodes formed. These nodes are Heberden nodes. If proximal interphalangeal joint is involved, and both side of the extensor tendon at the proximal interphalangeal joint there are nodes, means it is Bouchard's. Heberden, Bouchard's at the PIP, Bouchard at PIP, Heberden at DIP. Blood counts, ESR, CRP are normal. Plain X-ray, this shows the reduced joint space. X-ray shows reduced joint space, marginal osteophytes, joint deformities, synovial fluid predominantly viscous with low turbidity, calcium pyrophosphate crystals as seen in the investigation. Coming to the management, non-pharmacological therapy are short periods of rest during the acute pain. When there is acute pain, take the rest. Reduction of risk factors such as weight loss if obese, pacing of activities, use of walking stick for painful knee, weight loss. Physiotherapy including muscle strengthening. Non-pharmacological measures are rest when it is paining, weight loss, muscle strengthening, physiotherapy. Pharmacologic therapy are analgesics such as paracetamol up to 4 gram per day, that is 400 milligram per day. Oral NSAIDs such as ibuprofen, diclofenac, aceclofenac, etc. can be used. Topical NSAIDs and capsaicin are also helpful in relieving the pain and inflammation. Steroids, intra-articular injection of the corticosteroid can be tried. Intra-articular corticosteroid injection. So pharmacological therapy are 400 milligram paracetamol, intra-articular steroid injection. Surgical therapy, surgery is indicated if there is severe pain, progressive immobility and functional impairment. If there is functional impairment, severe pain and treatment is failed, pharmacological treatment is failed, then you can go for the osteotomy, arthroscopic debridement, arthroplasty, joint replacement. So these are the surgical options: osteotomy, arthroscopic debridement, arthroplasty, joint replacement.